This short video explains dysarthria, which is a motor speech difficulty. Dysarthria is a speech disorder. It is usually due to neurological changes or brain damage. Dysarthria can be developmental, for example, brain damage before or during birth, for example, cerebral palsy. Or it can be acquired as a result of brain changes later on in life, for example, a stroke or a progressive condition like Parkinson's disease. There are different subtypes of dysarthria, and a speech and language therapist is specially skilled in the diagnosis, characterization, and treatment of dysarthria. There are different subtypes of dysarthria. This depends on the underlying cause, brain damage, and characteristics of the speech. No two people with dysarthria are the same. Therefore, it is important to remember that guidelines and recommendations differ depending on each person and their specific needs. This video gives some general guidance and information. Dysarthria can impact respiration or breath support for speaking. Some people with dysarthria might find it difficult to modulate their volume or their vocal loudness. Dysarthria can impact voice, for example, pitch, vocal tremor, or vocal quality. Some people with dysarthria may have a monotone voice, or their vocal quality may be rough or husky. Dysarthria can impact articulation. This means speech clarity. Dysarthria can also impact resonance. For example, the nasal quality in someone's speech. Prosody is the rate of speech and stress when we speak. Speech and language therapists who treat people with dysarthria typically work as part of a multidisciplinary team in order to meet the person's needs. Speech and language therapy can help people with dysarthria through a variety of approaches. They can recommend strategies, exercises, or assistive technology. The speech and language therapist may recommend assistive technology. This can be high-tech or low-tech, and as simple as a paper and pen or an alphabet chart. The speech and language therapist may also recommend some exercises or practice tasks. These vary and depend on the underlying reason for the dysarthria. The speech and language therapist may also recommend some strategies, both for the person with dysarthria and for their communication partners. These are often specific and bespoke to each individual and their needs. Communication is a two-way process. It involves message in and message out. In order to facilitate expression and understanding, here are some simple tips which may support the communication for people with dysarthria. Reduce background noise. Face-to-face where possible can aid communication. Emphasize key words. Don't rush. Take your time and focus on one item at a time. It can be helpful to repeat if needed. It can also be useful for the communication partner to repeat the part that they do understand, so that the person with dysarthria can repeat the part that needs clarification. If you require further information, you can find it on the Irish Association of Speech and Language Therapists website. There you will find some useful resources, videos, and information. An example of a useful resource available on the IASLT website is a communication card for people with dysarthria. This and other resources can be found on the website.